to do this presentation. Now, I always say this, but it's a bit of a misnomer calling Patricia a volunteer. While we are very lucky to have her volunteering with us at the agency, she in fact was our ship coordinator for 10 years. And she was the ship coordinator at AgeWell when I started at AgeWell. And I found her presentations to be incredibly informative and educational. So I feel really lucky to have her back with us to do these. And with that, I will turn it over to Patricia.
Thanks, Sam. Welcome, everybody. I appreciate your time today. So today we're going to talk about, just kind of an overview to Medicare, whether you're starting Medicare or you need a little bit of refresher how Medicare works. We're going to go through all that for you today. We're going to talk a little bit about AgeWell, where they fit into it, and how Medicare and Social Security take all that information and start your health insurance, and then what some of your options are, and how does Medicare coverage work. We're going to focus on the federal side, and then we'll talk a little bit about Medicare fraud. So our mission here at AgeWell is really to help you age well. I mean, that sounds simple. It's with confidence and support and anything that we can do to help you, whether it's for yourself or a family member. We do everything from Meals on Wheels to our counseling for Medicare to options counseling if you need help in the community to get services. So SHIP is short for the State Health Insurance Assistance Program. You know, what we do best is our free and confidential healthcare counseling for Medicare. And it's for yourself, or if you're on Medicare, or a family member who's on Medicare or starting Medicare. The one thing that we can do that other agencies really can't is we understand how the state benefits work and as well as the federal. And we can kind of bridge that gap of information and say, this is how it will work for you personally, and this is what you can expect. And that's a huge value for what we can provide, as well as the classes that we have throughout the year. For any questions that you have, whether it be Medicare or otherwise, you can call the SHIP or you can call the helpline, excuse me, for SHIP or anybody else. And it's the 1-800-642-5119, and you'll get some help. So if you're starting Medicare, or this is how Medicare starts, you have an initial enrollment period of 7 months, 3 months before your birthday, the month of your birthday, and 3 months after. So many of you may have started, and that's fine. But what you'll do is on your card, it will say when Part A started and when Part B started. Some people start Medicare earlier based on a Social Security disability. It usually starts 2 years after that initial disability is ruled on. And then there are some instances like end-stage renal disease or Lou Gehrig's disease where you'll get Medicare much sooner. So sometimes you can delay Medicare based on employment if you're continuing to work past 65, because the eligibility age for Medicare is 65. And what happens is your information over the years is collected at Social Security, a lot of your work information and earnings. And then that gets fed up to Medicare. This is both federal systems. And then from there you get your card and you decide on what level of coverage you want to do or what you want to join. And we're going to go through all these pieces. But Social Security, like I said, they determine your eligibility for Medicare. They'll enroll you in Part A and B based on what you request. And then they're also the agency, the federal agency, that determines if you make a lot more money, then there is they call it IRMA. It's an income related monthly adjustment amount. You might pay a little bit more for your Part B and your Part D, which is the drug portion of the program. And they will leverage that IRMA not against you, but for you. Applying for extra help, they have financial help for some of the drug costs to help you pay for your medicines and your premiums. And then you can go to the SSA.website. It's a great website if you want to, get another Medicare card or change of address, anything like that. In general, if you're taking your Social Security financial benefit, which is a separate decision from when you take your Medicare, they will take the deduction for the premium for Part B right out of that check. if you're not taking your financial benefit yet, you're holding off, because as many people starting now, you're not at full benefit age till 67, then they're going to give you a quarterly bill for you to pay for your Part B premium. And the phone numbers are for the national and the local number down here in Burlington, and then ssa.gov. All the federal websites are .gov if you want to go there. So the Centers for Medicare and Medicaid Services, which is CMS for short, this is what your card would look like. And Medicare is a health insurance program. It's a national program, and it's for everybody who's eligible. It has nothing to do with income. Okay. And on this card, you'll see John L. Smith, you'll see his number, and you'll see when Part A started and when Part B started. And those are important pieces of information. And then you have your 800 number if you wanted to call Medicare directly, or Medicare.gov, which we'll talk about in a little while. That's a really great website. It's got a lot of information there, and it's a good one to know. If I'm going fast, please let Sam know and I can slow down. So let's say that you've started Medicare, which many of you probably have, and then you have options. Unfortunately, the Medicare Advantage option is not an option for next year. So we're going to focus in on the left side of this chart, which is the federal side, and that's what we also deem as like original Medicare. So Part A and B, that's what's issued by Social Security. And then you have choices. You can join a drug plan, which we highly recommend to cover medicines. And then your other option is to join a supplemental, also known as a Medigap. And we're going to talk about each piece of here, about what they cost, what they cover, and why it's a good idea to consider it. So for original Medicare, and most of these numbers that are coming up are going to be 2025, and there may be a little bit of a change in 2026, but we don't have that as of yet. So original Medicare Part A hospital, most people, if you've worked 10 years or more, you don't pay a premium for it, okay? If you've worked less, then they're going to leverage some level of premium at you. Medicare Part B, most people pay a premium, and if you make a lot more money, you'll have that IRMA if it's applicable. Okay. And then Part D, you can join an individual company, and there's many of them. I think there's about 11 this year. And you can join a drug company, and you would pay a premium to that company specifically. And then if you decide that you want to join a supplemental plan, then that's another piece of the puzzle. And then you would go to yet possibly another company and join a supplemental coverage. And all these coverages are individual. So you and your spouse could have different drug plans, and you could have different supplemental plans. It's just, it's an option for you. And again, if you are leveraged IRMA, which is that additional price, and you had a spike in your income, you can ask Social Security to look at that and see if they can determine that IRMA would only last for a year or two, and you can have an adjustment made. Okay. So Medicare Part A, I always talk about that as kind of your room and board, or the physical place. So it's usually premium free. It has a deductible. So if you go into the hospital inpatient, your deductible is $1,676, and that's per benefit period. So what that means is a benefit period lasts 60 days. If you went in January, you'd get leveraged a deductible. And then you came out, if you went back in May, 60 days has passed, you're going to get another deductible. So that's an important benefit that you want to consider when we talk about Medigap later. And then after your deductible's met, Medicare pays 80%, you pay 20%. So Part A will pay for an inpatient stay, it pays for skilled nursing, and then home health care or hospice. With those three, skilled nursing, home health care, and hospice, there are some prerequisites to get those covered. And those you would learn more when you're in that situation through your medical providers. Okay. Medicare Part B for 2025, the monthly premium is $185. Unless you have the IRMA, it could be higher. Your deductible is yearly, and that's $257. So what that means is when you go to the doctor or have a medical test or service, you're going to pay the $257 first, and then Medicare will cover 80%. And then you're responsible for the 20% after Medicare. So what does Part B cover? It covers your doctors, it covers your labs, it covers ambulance, durable medical equipment, if you get CPAP or you get compression or oxygen, all those things. And if you were going to go to the hospital, even though you're in the physical hospital, if you're having a surgery and you're coming out that day, that's Part B. So it's medical. Okay, so all outpatient services are under Part B. So it's an important part of Medicare for service. The one thing to know is that Medicare, original or federal Medicare, does not cover some things. And for those of you who might be, had an Advantage plan in the past, it's not going to cover eye care or, eyeglasses or hearing aids or dental. It will cover medical things, like if you had an issue with your eyes, but it's not covering glasses or exams type things. It's not covering healthcare outside the US, or it won't cover prescription drugs unless you have a specific Part D plan that you enroll in. So these things are all important to know, that there's definitely a difference between the Advantage plans and federal Medicare. So a lot of folks decide that they're going to work past 65 and they're eligible for Medicare, and then they have to decide, do I take Medicare? What should I do? So if you're 65 and older and you have a group health plan because you're still actively working, you can delay Part B, the Medicare part that has a premium, if your employer has 20 people or more. So let's say you worked for the University of Vermont and you wanted to continue working. You could delay Part B and keep your employer insurance. If you're on Medicare due to a disability, it has to be an employer of 100 or more people, because it's all about who pays first. Okay? And when you do decide to leave employment or stop employment, you get this special enrollment period that you can actually join Part B without penalty. So usually you want to coordinate that so one stops and the other one starts seamlessly, hopefully. And if for some reason you miss it, you have a general enrollment period to join every year for the first quarter of the year, and then it would start the month after. The one thing you want to be aware of, if you don't join Part B when you're at least first eligible, or when you have a special enrollment period and you miss a 12-month period and you're not covered, you can't necessarily enroll when you want, and then they're going to leverage a 10% penalty at you. And when you get penalties like this, the penalties stay, they don't go away. So it would follow you. You'd pay 110% for that premium for Part B. So you want to be aware of that. The other thing you want to be aware of, and it's worth an extra call into Age Well, is if you're on a health savings account, that employer has a health savings account, you really cannot have a health savings account with Medicare. So you want to figure out what specifics you need to navigate around that. So feel free to give us a call if you have questions about that. Any questions, Sam? I'm guessing not.
No questions.
Okay. Okay. So Medicare Part D is the drug portion of the Medicare program, and you get this 7 months when you're new to Medicare. It's their initial enrollment period to join, 3 months before your birthday. In this example, the birthday's in May, or 3 months after. So why might somebody join in August? Because maybe they don't take medicines and they want to join. If they joined in August, it would start in September. So it's going to start either May 1st or the month after that you join the plan. So an annual enrollment period is what we're in now, is every year between October 15th and December 7th. Everybody has an opportunity to look at their drug plan and change it for the following year. So for 2026, you want to make sure that who you had for coverage this year will work next year and understand the costs. And then certain groups have special enrollments under certain circumstances. So if you left employment, you'd get a special enrollment as long as you had credible coverage with your employer. If you move to this state, there are some people who have financial programs that help them, like Medicaid. You'd be able to change your plan when you'd like to. And then there's a late enrollment penalty I'm just going to mention. And basically, that penalty is when you don't join a drug plan when you're first eligible and you don't have other creditable drug coverage. And creditable drug coverage just is a term that means it's as good or better than the Medicare drug coverage. So if somebody said, I don't take meds, I don't want a drug plan, we would advise that you take at least the least expensive plan. And for next year, it's $8 and change. And carry that, because if something changes during the year, at least you'll have drug coverage. There are some groups that have already credible coverage, like the VA is considered credible coverage. Okay. So for 2025, the lowest premium was $12 for a plan. It's a little bit less next year. The deductible was $590, and then what happens is once you meet that deductible, you're going to pay co-insurance or co-pays. A co-pay is a set amount, a co-insurance is a percentage of the medicine when you go to pick it up at the pharmacy. But you need to join a drug plan, and we highly recommend that. You want to join a plan if you take medicines based on the medicines you take. And the best place to do this is on Medicare.gov, is to start an account, put in your medicines, and it will show you what's the best plan for the medicines that you take. And then if you have if you're continuing to work and you're not going to join a drug plan, you want to make sure that you have proof of credible coverage, and you would get that from your employer. And then, as I mentioned, in veterans or a lot of the employer plans do have credible coverage. You want to review your plans every fall to make sure they work for you next year. And especially, you don't want to be surprised. You know, a plan that might have cost you $12 this year could be $50 next year. And you want to make sure that you understand what things are going to cost you and that you're able to manage it. And then the best place to look for things for drug coverage is Medicare.gov, but you also have your Medicare handbook if that's available to you as well. So again, this is 2025. The least expensive was $12. The average deductible was $590. And then you're going to pay for your medicines based on what tier they are. So each drug plan has different tiers, and they're not standardized, so they could be very different. So under one plan, you might be paying $10 for a generic med. On another plan, you might be paying $0. So those are the kinds of things that to understand and to learn through Medicare.gov. It kind of levels the playing field. But this year, the out-of-pocket max is $2,000. So what that means is once an individual spends $2,000 when they pick up their medicines, you're done for the year. You'll pay $0 the rest of the year. In 2026, that cap is going up to $2,100. So my guess is a lot of folks are interested in this piece of the presentation, and it's the Medicare supplement insurance, or Medigap as we call it. You're guaranteed issue rights for 6 months when you're new to Medicare. Or for those folks who are losing their Advantage plans, you're guaranteed rights are for 63 days once your plan ends, your Advantage plan ends, and you should have received a letter from your Advantage plan saying that. The supplement is designed to fill the gaps of Part A and B, the hospital and medical coverage that Medicare provides at the federal level. And the plans are standardized. What that means is anyone selling Plan G will have the same benefits, but between Company A and Company B, the prices can be extremely different. So you want to understand which plan you want, whether it be Plan N or Plan G, and then look at the companies and what the prices are, and then decide from there. So look at the coverage, then select based on the coverage. And the premiums can go from, actually, some of them are less than 180, but they can go well over $250, and that's a month per person. So it's not an insignificant amount to consider in your budget coming up. Supplement is a second payer after Medicare. And what that means is it will only pay or follow after Medicare. So if you went to a hospital and had, I'm just going to say like a cosmetic procedure, Medicare is not going to pay for it. Neither is the supplement. The supplement only pays after Medicare. Okay. And then each one of the companies, and there's probably about a dozen or so, some of them you can apply online, some of them you can call the company directly, and usually they'll have a short, questionnaire for you, and then you can enroll into their program. But down below it shows that you pay the deductible, Medicare pays 80%, and then you pay the 20% coinsurance. The deductible and the coinsurance are the things that you're looking for the supplement to help you out with financially. You're going to pay them a premium so that they help you pay that when you use services. Okay. So the difference here is you're going to pay a premium whether you use health care or not. So you got to kind of figure out how much health care or coverage do you need or do you want. And right now this is I'm going to try and move something because it's covering my screen. Okay. So right now, this is a field of the supplemental plans, if you will. So some of these plans, like C and F, are only eligible for folks who started Medicare before 2020. So let's zone in on a couple of the plans like G, and G high deductible, and maybe N is in Nancy. The K and the L's are certainly available. It just gets a little bit tougher to figure out your bills when you're paying 50% or 20%. So it gets a little bit convoluted to understand. But on the left side, it has all your benefits. So all the plans with a check pay the Part A coinsurance, the hospital 20%. And then the Part B 20%, most of the plans pay, with a little caveat for Plan N, which we'll talk about in a minute. The ones that are highlighted, the skilled nursing facility and the Part A deductible, along with the 20%, those are kind of the most expensive ones you want to make sure you're going to get covered if you can. Currently, no plans cover the Medicare Part B deductible at the $257 a year. That would come out of your pocket. And then Medicare Part B excess charges, that is illegal in the state of Vermont. But if you were to get health care in another state and they wanted to charge more than Medicare allowed, then you could theoretically get an extra charge. And that, if that supplement took care of it, like Plan G, it would pay for the excess charge. And then foreign travel or emergency, that's a benefit for people who are out of the country, and if they have some level of emergency, you can ask the companies more detail about that if you're one to travel out of the country. I know in my instance, if somebody was to travel out of the country for a certain amount of time, I would have them get a travel policy separate. But in looking at these supplemental coverages, the fullest coverage you can get right now is Plan G. It covers everything but your Part B deductible. There's also a Plan N, which is a great plan. It covers it doesn't cover your Part B deductible, and if you go to a medical appointment, you pay a copay of $20. If you go to the emergency room, you pay a copay of $50. So the theory there is you kind of cost share and your premium might be a little bit more manageable or a little bit less. So those are the kinds of decisions. So when you look at supplemental coverage, I always think that it's based on your health and sometimes it's based on your future health. It's based on your money and it's kind of based on your personality. And what I mean by that is how much risk are you able or willing to incur? So those are the kinds of decisions to think through. So I've had a few people say to me, I don't use a lot of health care. I don't think I need one. I would implore people to look at least Plan G high deductible. Plan G high deductible means that you would pay it's right down here, $2,870 in medical bills, but after that, you'd be 100% covered, okay? And that's important. Why? Because your health can change at any time, and the cost of medical care, if you had to have, CAT scans or MRIs and testing, it can easily surpass that deductible. So it's kind of a great safety net, and your premium would be a lot less. It would probably be in less than $100 a month. Okay, so that's a consideration as well. Down below, the Department of Financial Regulations is a group at the state who actually governs and regulates the supplemental plans. They actually have who can sell a plan. They regulate what the prices are. They have to approve increases. And that link down there will actually give you information from the state of Vermont agency to tell you what the current prices are. Okay. So in this one, we're going to skip option 2 because that's not available to you. So really you have option 1 is to get hospital, medical, and drug coverage. It's good coverage. It's probably the least expensive way you can go, but your risk is if something changes, there's no out-of-pocket maximum or there's no secondary coverage to protect you should you need other some intense medical care. Option 3 is you'd have hospital medical, you'd have drug coverage, and then you'd get a supplement. It's very full and predictable coverage, but you pay a premium whether you use it or not. So it's a little bit higher risk, or excuse me, a little bit higher cost, but much lower risk. So if something happened to you and you had Plan G, and God forbid you had to have a surgery and other things next year, you're out of pocket, as long as it was covered by Medicare, you're out of pocket after the premium would be the Part B deductible, which is the $257. And that's what I mean by it's a lot more predictable. Sam, do we have any questions around supplemental insurance?
Not around supplemental insurance. A couple questions around initial enrollment. So I don't know if you want to save those or tack those now.
I'll take them.
Okay. So I'm a bit confused about the special enrollment period for Part B. Does it begin as soon as we stop working? We then have 8 months to sign up for Part B. As an example, if we quit work in June, when should we sign up for Parts B, D, and Medigap to avoid penalties?
So let's say that you're going to stop work, you're on Medicare or you're on Medicare Part A, you're going to stop work the end of December. What happens is for Part B, you have to go to Social Security and you have to bring a form for your employer. So you have to coordinate it with your employer because they got to fill out a form to say you had coverage. And most people would have employer coverage stop 12/31 and Medicare start the 1st of January. So most people coordinate it so that there's no lapse in coverage. Okay. I don't know that many people wait till that 8th month and go without coverage. The other piece of it is first you will have a special enrollment period again of I think it's 2 months to go ahead and get your drug coverage in line. And you can join that, so you could join that in December to start January 1st. And then when your Part B starts, you get 6 months guaranteed issue into a supplemental plan. Okay. I hope that made it a little easier.
Okay, I'm going to try to see if I can figure out a way to roll these other questions into one. Um, so, as fast as they're working, and I have been on her insurance but qualify for Medicare, can I apply for Part B and Medigap at any time, or do I need to wait for open enrollment period to avoid penalties? I'm going to give you the other two as well, Patricia, just because I think it's all kind of tied together. Um, can I wait to sign up for supplemental insurance for 5 years without a penalty? And then what is underwriting?
Okay. So I'm not sure I got all of that. The first part was, can you
First part
repeat?
essentially was, can I apply for Part B and Medigap at any time, or do I need to wait for open enrollment to avoid penalties?
Open enrollment has nothing to do with Part B. Okay, open enrollment's based on your situation. Are you eligible? And then if you have employer or spouse's active plan. And if you question this, you're welcome to give us a call. So if you are 65 and eligible and don't have any other insurance, you need to start Part B. If you have employer insurance based on those size recommendations, you're 65 and your wife or spouse works for an employer over 20 people, you can delay Part B. Okay. So I think that's the situation. Open enrollment is for people who are on the plans and continuing. It's a review every year. But when you're just starting out, you have different rules. You have special enrollments or initial enrollments. And the second part of that question was, I'm sorry.
No worries. So, can I wait to sign up for supplemental insurance for 5 years without a penalty?
So you're not going to get a penalty from supplemental insurance, okay? The risk that you do, can you wait? Sure. But the risk is they don't have to let you, they can say no to you or they can underwrite you. And underwriting means that um, if you had a lot of medical stuff going on, they're probably going to turn you down before underwriting you. But underwriting you means that they're going to they could potentially charge you more because you're going to cost them more. My experience is that they've said no before I've ever really known anybody underwritten. In the state of Vermont, the supplemental plans are community rated, meaning that you're going to get the same price as the next person. But if I came in, with a couple of health issues that are going to cost them a lot of money, they're going to say no to you. That's the risk. And then you won't be able to get it. With the supplementals, it's interesting because what you want to do is you want to be realistic with the coverage because you don't want to spend a whole lot of money now because the insurance companies, the premiums go up. And then when you're, 80 years old, when you need it the most possibly, you can't afford it. So you want to be cognizant of that. So maybe instead of waiting 5 years, maybe a Plan G high deductible is a good way to go, that kind of thing. So you have some level of coverage, but not so much that you can't afford the premiums. So there can be some different strategies and when you join these plans and how you want to do it. The other question I get a lot of times is if I was in a Plan G high deductible, could I change to Plan G regular? And the answer is maybe. And it might be easier if you had a company that sold both, because then you're already their customer. So they don't have to start the process, the initial process over again in the questionnaire. But they don't have to, but that's based on individual companies. Okay. Anything else?
Nope, that's all for now.
Okay. So Medicare.gov is a great website because you can go there, you want to sign up and start an account. You can look at you can ask, you can look at questions if you want to know, is this thing covered? Is this not covered? The one thing to know about Medicare Part B or coverage with Medicare is, I always like to say it's like a la carte. So you might have a preventative, a welcome to Medicare appointment, and you go in, it's going to have some basic screening things. Anything, if you got involved into a health issue or something else, they're going to put codes on your chart. And according to those codes, you're going to get billed. So it's not everything you can get in 15 minutes. It's going to be, these are the issues we discussed. So you can go on Medicare.gov and you can look and say, is this preventative? What gets covered? It's a great place to look at your claims. But more than that, this time of year, it's awesome because you can go in and put in your medicines, and it's going to show you, especially in the drug coverage, it kind of levels the playing fields and shows you what's the least expensive plan for your meds that you're trying to get covered. Okay. And you want to put all your meds on there, even if you occasionally use a med, put it on there and say you get it once a year, just so you know that plan would cover it should you need it. Okay. But so I highly recommend you start an account at Medicare.gov. And then from here, there's some things to know. You want to protect your Medicare information. You want to make sure that your providers get it when you're eligible for Medicare, and know who you're speaking with, and keep records when you're talking to people. Okay. The federal government, their websites are always .gov. So be aware of that. And you can start Medicare on SSA.gov. You don't even have to contact them. Just go into your Social Security account. But there's a lot of reps that can help you, whether it be with drug coverage or supplemental coverage. Just know that every rep doesn't sell every plan, so it's important to educate yourself. And Sam sent out the Department of Financial Regulations information on the supplements, on who are the companies and some of the contact information. And salespeople are not allowed to approach you unless you've opened the door to them. And what that means is especially when you're new to Medicare, you're going to get inundated with a lot of mail, and it might look very much like Medicare, but it may not be Medicare. It may be a different health insurance company. And if you contact them, then that opens the door for them to contact you and salespeople to come approach you. But if you get anything suspicious, feel free to report it to AgeWell or to Medicare directly. Okay. These are some of your resources. Obviously, you're familiar with AgeWell. There's a Health Care Advocates, which is a legal group downtown in Burlington. You can call and ask for advice. And then your Social Security and Medicare numbers. And then Vermont Health Access is the state of Vermont, if you wanted to call and see if you're eligible for benefits there or had questions. And then the Department of Financial Regulations. Okay. Anything else, Sam?
Yeah,
That was
one just came in that I think people usually have questions about, so I think it's a good one. If I'm on a Vermont Blue Cross and Blue Shield HSA and my birthday is in March, can I contribute in January to the HSA before I go on Medicare while I'm still on Blue Cross and Blue Shield?
Yeah, I think you can contribute, but once you go to Medicare, you can't. Okay. So I think it's the Medicare, when your Medicare starts, that's when you're cut off. And what would happen is it would get more complicated for your taxes. So you want to find out, I think once you become Medicare, you can use the money, but you can't you can't contribute. It cuts off that contribution. Okay. Any other questions? So another good resource, you could talk to pharmacists if they have any opinions, if you have a trusted pharmacist. And you can call your insurance company directly. So if you're on a plan now, like let's say a drug plan, and you want to check it for next year, you're welcome to do that to help expedite some of your choices. And if somebody was starting next year or starting in December, let's say your birthday was December, you can consider starting a drug plan December 1st or January 1st, and we could talk about that individually. Okay. Well, I hope this was helpful, and if you have any other questions, let us know.
All right, thanks everyone for attending. As I mentioned, this was recorded, so it will be posted on our website and on our YouTube channel. So if you need to access it, it'll be there. Hopefully, I guess probably tomorrow. I send it to our development folks and then they post it. So thank you all for. Oh, all right, Karen, I got you. What's your question, Karen? Yeah, I can link the YouTube channel here.
And the other thing I just want to say, there is a class out there for Medicare supplemental coverage only. So if that's of interest, that's available as well on the YouTube channel.
So yes, we do have Medicare and you handbooks. If you need one, I can get one to you. So Karen, if you just want to email me, I can send you one. No problem. All right, great. So again, thanks for attending, everyone.
Thank you so
And
much.
thank you, Patricia. Yeah, have a great day, everyone. Thank you.
Bye-bye.